Okay, so this is the CPM machine. Not all surgeons or orthopedic surgeons will require a knee replacement patient to have one. However, if they do, the physical therapist will get it set up, put the lambskin on, set the patient up on it so that it fits to their specifications and leg length. So the arms will be adjusted, so you all won't have to worry about that. But after it's been set up, the therapist will take the remote and set up their first range for what they can tolerate, for extension to flexion. So how straight they can get it to how much they can bend it. And what will happen after that is once it's set up, there's a timer that we'll set for the 2 hours, and they're supposed to be put on at the 3 to 11 shift in that afternoon for 2 hours. So we'll set up the timer, we'll let the nurse know, and making sure the call bell is within reach. So subsequently, what will happen is there will be orders to increase that flexion by 5 degrees each time it's put on, if the patient can tolerate it. So there's the remote, and what you'll do is kind of put it on first and then hit the start button. You want to put it on when it's straight. So as you can see, it's bending now. And it'll have, and we'll show this in a close-up video, it'll have the degree of extension, or how straight it is, and then how much flexion or bend it'll have. So this one is set to 50 degrees. So it'll have the actual target flexion here of 50 degrees, and you'll see the number counting, which will show what it is at this point. So now it's 48, now it's 50, so it stops. So you want to ask the patient, how is that? Does that feel okay? They say yes, and you say, okay, well, what we're going to do is do 5 degrees more. So, and I'll show you this. You'll hit the button for the flexion, and I'll show this on a close-up video. And then you'll increase it 5 degrees. Okay. And then what you can do at this point is you can hit stop, then start again to start it. And then you don't have to wait for it to go all the way down, but it's okay. You can have it go through the whole cycle. So now it's on 30 degrees and it's coming back to bend. So now the patient should expect, and you'll let them know, and now it's on 55 degrees. It'll be a little bit more of a stretch. So you want to let them know every 10 degrees where it'll be. So this is coming up, this is 50, now 5 more degrees, that's 55. Now obviously they won't have, everyone won't be on 50 degrees. It might vary from patient to patient, but the goal is to have them wear it for 2 hours, increase it 5 degrees each session they have it on, up until they reach 90 degrees. Once they reach 90 degrees on this number, then it'll be discharged and they no longer have to wear it. So here's a close-up of the remote, and here's the display. Right now it's on stop, so I'd hit the stop button. This side of the remote or the display is the extension, so how straight it goes, and this is the button to set the extension. Usually it'll be 0 degrees or completely straight. If it needs to be less or anything, we'll adjust that, but that's going to be 0. And as you can see, it's all the way straight here now, so it is on 0. And whatever angle it is on, it's going to be in this number here. So this is extension, this number. This is the bend, this is flexion, so it's at 50 degrees. So if you want to adjust it to 55, you hit the right arrow button going up, because that's the way that's bending, is going up. Hit that, you'll see the number flashing. Then you hit the plus sign up to 55. Once that's done, then you can hit start, and it'll say run, and this is the counter saying how many degrees it's going up by. So this is when you want to tell the patient to expect that it's going to be a little more. You want to kind of give them an idea of what range they're at, so they get an idea of what to expect. So that you're at 30 degrees. As you can see, it's starting to bend here. This is going to be 40 degrees here. And once it goes all the way up, then you can tell them that's the max it'll get to. And then it'll pause there for a few seconds, and then it'll go back straight, and then you'll see it counting down. If for some reason they cannot go all the way up to 55, you want to hit this stop button and then hit start again, and it'll start going down. And then here's the timer button. This kind of lets you know the session time, and this is on for 3 minutes right now, But if there's a timer, we'll make sure to set that up, so don't worry about that. But it will be on for the 2 hours. There is the timer button. However, if it's not on or you're unsure, let the nurse know at all times when you put the device on so they can mark it in their chart, and then also what time you take it off.